When I communicate with patients about neuropsychiatric symptoms that they're experiencing, there are, of course, some people who are unaware. It's not the majority, though. And I have to say that's different than my own training 20 years ago. We really were assuming most people living with dementia, after the moment of experiencing these neuropsychiatric symptoms, were completely unaware, blissfully unaware, potentially. In reality, they do recall some of these events many times, and they can be quite distressed by them. So in some cases, I may ask about just mood. How are you feeling on general days? Have you been feeling low? How have your nerves been? I do practice in the South. There are certain culturally appropriate languages, idioms to use in our space so that people feel maybe more comfortable describing. I often will ask about their frustration. So I'm interested to know about emotions like anger and how well they're able to regulate those things. This is when things start to get a little bit more sensitive sometimes. I've talked to spouses in particular, so patient and their primary caregiver is their spouse or adult child, and they will talk about flying off the handle and screaming at them and the guilt that they're carrying. Now, I have no idea how many times this has happened, but it has certainly made an impression on them emotionally. Remember, you have different parts of memory in your brain, and emotions stick with you. Sometimes I'll ask about crying, and even the question of asking about being tearful will sometimes elicit tears. And so my role then is to, of course, make some space for that to happen and offer as much empathy as I can. It's going to be challenging to counsel around this because with the patient in particular, right? Most cognitive behavioral therapy counseling depends on the patient being able to have abstract thought and reasoning and reflection. Those things may be limited or impaired. It doesn't mean that I don't try to approach those. But in all cases, asking about some of these neuropsychiatric symptoms does come with stigma potentially. And so there really is some sort of gentle and delicate questioning around this. It certainly is not my first question in the room, right? So we're going to begin with things that may be more comfortable until we've established a relationship, a rapport. Of course, seeing the patient as their primary care provider builds a very strong foundation for asking these questions. I have not yet, in all of my years of taking care of only people living with dementia, no one has said to me or questioned why I would be asking them about neuropsychiatric symptoms. They are generally relieved that someone has asked the question and made the space for them to talk about how they feel and their own experiences.